mynews.studio.
Syringes, factories, patents. Can a new global deal finally prevent vaccine inequality before the next pandemic?
Today is June 26th, 2025. After COVID-19, we all saw just how much uneven access to vaccines and diagnostics could prolong a global crisis. Now, almost every country has agreed to a new legal framework with the World Health Organization. The goal is to avoid making the same mistakes again.
Let's get into what's actually in this agreement. First, countries are now required to make pandemic drugs and vaccines more accessible and affordable everywhere. But this goes beyond just sharing doses. It's about changing how the global supply chain works. So, what does that actually look like?
One big change is a push for transparency in the supply chain. Countries will have to share information about medical materials and stockpiles. There's also support for setting up local manufacturing, especially in lower-income countries. That's meant to address the bottlenecks that happened in 2020 and 2021. But
if patents and intellectual property are still in play, how does local manufacturing actually happen?
good point. That's where technology transfer comes in. The treaty has provisions to prevent intellectual property from blocking local production. In a pandemic emergency, there could be temporary changes to patent rules so knowledge and technology can be shared.
Do you think that's enough to actually speed up vaccine rollout everywhere? Or are there other obstacles we should think about?
Well, building new manufacturing isn't just about patents. There's the need to train staff, expand infrastructure, and keep quality control in check. Technology transfer itself can be slow, but the agreement does set a standard. Countries are expected to help each other build this capacity, ideally before the next crisis.
Another big feature is the Pathogen Access and Benefit Sharing System, or PABS. In a pandemic, any manufacturer making vaccines or therapeutics would have to give 20% of their output to the WHO. That's a significant share. Distribution would be based on risk and need, with a focus on developing countries. Do you see this as a real way to close the equity gap?
It's a big move, but enforcement is tricky. The treaty is legally binding for countries that sign on, but the details on oversight and accountability are still being worked out. Plus, how fast can the world actually respond when the next threat shows up?
And let's not forget, this isn't finalized yet. The agreement needs at least 60 countries to ratify, and the whole PABS annex is still under negotiation. So realistically, we might not see full implementation until 2029. With that kind of timeline, what keeps countries committed and accountable while we wait?
There's a coordinating financial mechanism, plus an annual review at the World Health Assembly. There's also a fund to help countries that need extra resources. But keeping up political will and funding over several years, that's still a big question mark.
So in short, the world has taken a real step toward a fairer pandemic response, with legal commitments around access, transparency, and local production. But the test will be whether these commitments turn into action, especially when the next crisis happens.
We've talked about the new global rules, the effort to build local manufacturing, and the challenge of making legal promises a reality. Is this a turning point, or just the start of another long process?
That's our story for today. Can global solidarity move faster than the next pandemic? Thanks for listening. This episode was brought to you by mynews.studio. Try it now for free.